long hair transplant is the highest level of FUE transplantation around. We take the entire follicle and the entire length of the hair and move it, and it has the advantage of having near full results immediately, so you can really get perfect density. And the key is that we can use the curl of the hair to perfectly position that so that it's curling in the right direction along with the right angulation to get the best results.
That was the voice of Daniel A. Danyo, MD, founder and physician at North Atlanta Hair Restoration, a boutique medical practice solely dedicated to the diagnosis and treatment of male and female hair loss. And you're listening to Hair Restoration with Dr. Daniel A. Danyo. I'm your host, Clark, and all season long, we're speaking with Dr. Danyo about how he and his team at North Atlanta Hair Restoration are helping his patients transform their everyday lives for the better. In this episode, Dr. Danyo explains the advantages of a long hair transplant. It's a procedure where the entire hair follicle is moved for full concealment and same-day results. He also breaks down the different types of transplants he offers. There's so much to talk about, so let's dive right in. Dr. Danyo, we are back. It's so great to be connected to you again. I can't wait to jump into today's topic, but first, how you doing?
I'm doing great. Yeah, things have been busy at the office, and
you're so busy.
I know.
You've been very busy.
We've been averaging about 7 cases a week. I'm having more and more days where we're doing 2 large cases in one day, just because, I'm doing a lot of consults. We have a great way for people to do online consults. So I have people coming from all over the country. The problem is just getting people on the schedule. And so we've just had to turn it up and get people in.
We've talked previously on this show. I mean, this is really a great way to get to know you, to get to know this boutique practice, the approach you have, the intentionality you have, and you are the person doing all of this, meaning, it's got to be tempting, I would imagine, to introduce other people to help pack in more people. But it sounds like once you hit your max, you're kind of at that max because of how you've built the practice. Because what I'm saying is you do everything from the start to the finish working with each patient. So
yes,
I know you've been busy, and we've also talked about how you try to keep it all together, because it's pretty strenuous to do this kind of work.
It is. And the problem is, because we're so unique, I do all the extractions and placements, and just the training to get to the level that I am, it's not something that I would feel comfortable even farming it out to, say, a physician's assistant at this point, or even another physician, unless they're just extremely trained. So the problem is it can cap me out as far as what I can do physically and just what I can do with my staff in a week's time.
Well, I know we've talked about some of the big races you train for and the fitness and all the exercising you do, the good health, nutrition, all that, because you're sitting there, standing there in specific positions trying to do these procedures, and it's challenging. Yeah. So you got to keep taking care of yourself, because I know there's a lot of people who are still on the schedule and want to get these kinds of results. And it's been so great hearing the feedback that you've been hearing from people listening to not just 1 or 2 episodes, but oftentimes they're listening to several, because this is a close-up look into the work you do, why it matters, why you love it so much, and we also answer some common questions that you get. So anyway, I'm excited to be back for another episode. So today's topic, this is all about long hair transplants. Now,
yes,
we have often talked about hair transplants, and you teach me a lot because I'm learning a lot as we go through this. So the most obvious question is, why is this different? Why is this one called long hair transplants? Is it for men? Is it for women? Does it not matter? Let's just dive straight into that and then talk a little about the how and the why behind it.
Sure. So long hair transplant means that you're taking the follicle. In most hair transplants with FUE, the hair is actually cut either before or during the extraction. So when you move it, the hair is short. So you kind of have to imagine what it's going to look like, with short hair. And I'm talking like a zero guard short. Now, the long hair is you're going to get close to a full result when you leave the day of the procedure. So, for some people, especially with concealment, I mean, there's no other way to better conceal that a hair transplant is being done than doing a long hair transplant. Because let's say you're working on the frontal hairline, you're just moving that hairline forward with hair, and it looks natural, and you can't actually see individual grafts.
And the significance of being able to leave that same day. I know oftentimes you say someone might come in, they might take a day off of work, but they really don't have to, and they've been able to go in pretty much the next day after a procedure. These procedures take several hours, depending on how much work you're doing, but I don't want to just gloss over that. That's a really big deal.
No, it's huge. And it's really been a quest of mine. Early on in my practice, I recognized that this is such a kind of a quiet procedure for people. They just don't want to broadcast that it's being done. And they also don't want to have to take off a week or two of work and just kind of sit around. And a lot of people don't even take a vacation. They just take that time off to heal. So, we've talked about the shaveless procedure before, which is great because the donor site's concealed. And if there's enough hair up top, you can conceal that the grafts are being done. And, we've talked about the art of concealment where we limit the amount of medications we're using. We use pen implantation where we don't have to add medicine to kind of lift the scalp off, the skin off the head to do surgical slits. And, we've just made it very clean so that people don't get swelling, they don't have a lot of pain, and they can get back into the swing of things quickly. And that's really just been through determination, trial and error, and just perfecting what we do.
It's taken a long time to get to where you're at, so that's a great reminder. Now, I think you just said concealment, right? That's
Yes.
one of the big parts of all of this. And can we kind of get into the details of what do you mean by that, and how does that connect to the actual procedure? Like, what's actually happening? So, the way I'm envisioning it, long hair transplant, you're actually preserving that hair, and in that case, it's actually growing out pretty long,
Yes.
and you're kind of replanting it. I think of it as like you're replanting a tree,
Yes.
as we've talked about before.
Yeah. So the analogy would be if you were replanting a tree, the traditional FUE would be you're cutting it down to essentially the base of the trunk and then moving it and waiting for the plant to grow. But we're taking the entire plant. So,
Do you get better results that way? I mean, I guess results, success means different things to different people, but if you're trying to conceal, that's got to be better. You're not shaving down.
well, one of the key elements of long hair that makes it actually more accurate is the fact that the hair has a natural curl to it as well as angulation. So when you extract hair from the head, the hair is angled down, but the curl is angled down. You want that curl when you place it, especially on the frontal hairline, you want the curl to be down as well. You don't want hairs going down and up and to the left and to the right. And with a long hair transplant, you can take that curl and put it perfectly in position. If you look at like a telescope, say a submarine telescope, if you move say 5 or 10 degrees to the left or to the right, that can have a huge impact on where that viewmaster is. So when you have a long hair, you're able to take that curl and just completely match it with almost 100% perfection so that it creates a very natural look, probably even more accurately than a shaveless procedure. Although, I do this under loop magnification. So as I'm placing the grafts, I'm looking at the angulation, but I'm also looking at the curl of each hair. But just having that fine tuning of say 5-10 degrees, it's more accurate.
That I just still can't get over how you have to do this literally hair by hair, and you're zoomed in. I know you use the telescope, example here, or like a submarine scope, But you're wearing a lot of like the zoom magnification that you're wearing. Those small details. That's it's significant.
Yeah, it's 5x. I've had a lot of a lot of physicians that have come into the office and that have actually been experienced surgeons that have used loops. But when I give them the 5x loops, because you're really looking through a very small hole. The higher the magnification, the smaller the field of vision is. It's very hard for them to kind of get used to it. It actually takes months to possibly even longer until your brain adapts to being able to look into that viewfinder and then look out and then back in and back out, because that's what the hair transplant requires. So it just adds to the accuracy when you're placing.
That's really cool. And for something, I've never done this. I don't think I'll ever be in your position, so I don't really know how to compare. But what do you think is harder for you, or maybe harder for the patient, if it is long hair transplant or sort of the, how you can do the shaveless FUE on other things?
Well, I mean, the long hair transplant is by far the highest level of the follicular unit excision, where we take individual follicles. Also, it's harder for my technicians who are pulling the grafts, because all the hair is long, and all you're going to see is just a small circle around the follicle, and they also have to be wearing loops to find the follicles to pull them. And if it's really long hair, a lot of times with women, I mean, it can be 12, 18 inches long. We extract a little, place a little, extract a little, place a little, just because when you have a lot of long hairs, it just becomes kind of a management issue. And so we have to position a little bit differently, more upright. So we'll generally extract maybe 20 and then place 20, which ultimately is probably a better way to go anyway. Get them out, get them in. But it's definitely more tedious and, more time consuming.
Right on. And when you're taking a little, putting a little, is it kind of like when an artist is painting, you kind of close up and then you might walk a few steps back to see how's it
Oh,
looking? Is that sort
absolutely.
of what you're describing?
Absolutely. And, we can really interact with the patient and, give them the mirror and what do you think? And, they can say, oh, I love it. Or do you mind adding a little bit more right here? Because in my mind, working together with the patient and getting exactly what they want is key. It doesn't take a lot of extra time. In fact, it kind of makes my job easier if we work together.
Right. I dig it. Okay, so you mentioned the patient just now. If you're interacting with the patient, how does this kind of outcome, from the patient perspective, what kind of outcomes are they normally expecting? What kind of results? What kind of success? Do you see, is this different than most of the procedures you're doing? Is it similar?
No, I mean, the outcomes are similar. I mean, if not better, just because, we talked about that angulation issue. I mean, we can get really fine tune it and perfectly place the curl and the angulation. We really get a good look as well. I mean, from a density standpoint, when you're putting in short hairs, I've done it enough that I know what certain areas require and how to place them. But when you have the hair in, especially if there's really coarse hair, you may not have to put as much density in a certain area, and you can use it in other areas. So that makes things much easier.
I mean, this all makes sense. It's just one of the methods that you've got in your tool belt. And for someone, if they have not listened to other episodes yet, would you want to take a quick moment just to explain, zoomed out, kind of the different ways that you can do this? Because not all patients are looking for the same thing, right?
Sure.
Sometimes people need different things. So how does long hair transplant sort of measure up to the rest of what you're doing?
Well, again, it all depends what the needs are. If there's a huge need to conceal, recently we did an actor, and he wanted total concealment, and was going to be doing some shoots probably in the next week. After the procedure.
Like video shoots,
I'm
something like
talking
that?
like doing a Netflix series.
What?
Yes.
Well, you got to remember you're in Georgia, right? So
Yes.
you got that is like made in Georgia. You got a lot of activity
Oh
there for
yeah.
the. I didn't think of that.
So he had a very small window when he could do it, and
No pressure.
yeah, and so in talking in the consultation, he was very much he didn't want anyone to know, but also didn't want a huge amount of time off because it was a small window that we were working in. So I offered long hair transplant. We did 1,500 grafts. His donor site hair was about maybe an inch long. So we placed it all in, and just extremely happy, with the results. And
Wow.
he was able to go, very stealth. Nobody knew anything.
Stealth
Yeah.
mode. It's important. I mean, this is his career. I mean, a lot of times people are doing this maybe for it's for personal reasons, and someone they don't come to you just to get this procedure done. They're coming to you because the way they want to feel later.
Yes. And we've talked about, other instances where you have maybe somebody's on a board of a large company where they have emergency meetings, or they just have to be present and they're really unable to take time off. Going as stealth as possible for them is just really important. It's just another option. It's another tool. I would say, it's easier, obviously, to do men that have shorter hair, and it's more difficult with women. I mean, one of the big concerns is you have long hair and you could potentially dislodge the graft.
What do you mean by that? What do you mean by
Well,
that?
you kind of comb your hair or pull it back and you pull the graft out. And I actually have not had anybody pull a graft out, even with long hair, which is pretty awesome. Obviously, they're careful, but you would imagine having long hair, you could easily tug on the graft and pull it out. But that really hasn't been an issue. And even there's a doctor in Uruguay, Dr. Travaglini. He's gone almost exclusively to long hair because of the accuracy with that curl that we were talking about. And they really don't have people pulling grafts out, even with different hair lengths.
Wow. Man, but what you're working towards though is that feeling someone gets, whether that's like the person you're talking about, the actor that how to get this done, stealth mode though, to feel more confident, to be able to be better for the role, be better for job, work, all that. But you've also got the people who are enjoying the other side of this and their
Sure.
lives are
Right, or
impacted.
45,
And
to the
anything you
left
want to
and right.
add on that?
Well, the way we do the long hair, we have actually a long hair transplant machine, and it has a special punch that actually has a groove in the hair. So when you're grafting, you can set that little groove to be down, which is what you want, and you can set how much oscillation, because it doesn't spin, it oscillates. And I generally like to do about 120 max, maybe 90 degrees of oscillation. So it's going 60 degrees to the left and to the right, or 45, to the left and right. And that groove will actually kind of capture the long hair and keep it from getting cut as it oscillates back and forth. And so you can go deep to the follicle, and then you have this long hair that's left over.
So it's like a high tech scooper.
Yeah,
It's how I'm thinking about it.
yeah,
It's just a really sensitive way to pull that. Well, it's not like you're pulling a hair. Like, we can all like put your hand in your hair and then like kind of pluck out a single hair. But in order to go in and do what you're doing, you're going a little bit beneath that surface, getting the actual follicle.
yeah. And the nice thing is the actual way, like when I do a shaveless procedure, I cut and core the hair at the same time with the punch. The punches that we use are trumpeted, so it kind of cuts away. So I can cut the hair as I'm coring. So I don't pre-cut the hair when I do a shaveless procedure, but my punch will cut the hair, and then we leave everything else long, to conceal the donor site. So there really aren't short hairs left in the donor site when we're done. When I used to pre-trim with scissors, for one, it was just exhausting, and I cut a lot more hair than what I was taking in the donor site wasn't quite as concealed. So the nice thing is the actual motion, the depth, everything is the same as when I do a shaveless procedure, which I do all the time.
What do you think the pie chart looks like of how much shaveless FUE work you're doing compared to the long hair?
Well, the long hair is still small. We started out with very small cases, doing like 250 grafts, and we really didn't have much of an issue. And then we went to 500, and the most that we've done is 1,500 with long hair. So it's still probably less than 5% of what I do, but it's something that we're in the process of kind of actively marketing. And I also had to develop a comfort level. Obviously, there's kind of a higher risk of pulling the grafts out, but again, I haven't had anybody have that as an issue, even with really long hair. So I'm at a level now, like we're doing this podcast to kind of present it to people to say that this is a total option if you want full concealment and you really want total accuracy in the placement of the grafts.
And part of the advantage of that is you can see how that curl is coming out. You can see, I mean, there's,
With the curl, the
I
density.
love the analogy.
Yeah. Now, some of the hairs do get cut, I'll be honest with you. So it's probably, I mean, it can vary. Some people, there aren't a lot of hairs that get cut, and then others, it might be 25%. There are also some dormant hairs in the follicle. So I tell people, I mean, expect to have probably 25% more visible hair than what you see now. And they're always happy with that.
I love it. Anything else you want to touch on those results? And because what you're working towards and your team is working towards is that checkup of when they come back and you can see this difference,
Yes.
right?
And you see it immediately, which is great.
People haven't like an aura, like an energy field, I think. And I don't get too deep on this, but I feel like if you're taking care of that, people can sense it.
Yes. Yeah. I've always tried to, in my practice, figure out what are the needs that people have. I was in pain management before, and my practice, I did it so that, let's say you were coming in for an epidural, I could do it in a very painless manner where you didn't need sedation. You could drive yourself and then drive back to work that day versus having to go to a surgery center, having somebody drive you. You're getting all these monitors and IVs, and you're kind of laying on a gurney, taking up your whole day. And that's two people out of work that day. And for me, that was unacceptable. So I came up with a better way. And, I was busy doing that part of, my physician work because of what we did. And people appreciated it.
When someone gets this kind of procedure, the long hair transplant compared to some of the other procedures you do, is the recovery different? Do you need to care for the hair differently?
You just have to
Is
be
it the
more
same?
careful. It's the same. I mean, we want people to wash the hair. I think it's very important to immediately wash, even the night of the procedure. Like when you go
Really?
home. Yes.
Why is that? Why immediately like that? Same
Well,
day?
because there's, whenever you have a wound, let's say you had a cut, you would wash it. If you didn't, it would get very crusty. So let's say you're doing 1,500 grafts,
Oh.
you're going to
It's like
get
15 little pokes
well, you're
almost,
going to get
right?
you're going to get crusting around each graft,
Wow.
and if you don't wash it off in the first 2 to 3 days, because it'll accumulate, it's just kind of part of natural healing. Then it's very crusty, and you get itching, and you lose that concealability.
Mm.
So it's very important to wash. I don't have people washing grafts out. I always tell people I have a spray bottle that when I clean the grafts, I'm spraying as hard as I can about a centimeter from the graft, and it still doesn't wash out. So
Wow. So you're saying you do clean as you go?
as we go, and before people leave, but even so, because there's going to be drainage, you just have to stay
It's
on
just how
top
it
of that. You
happens.
just have to keep it clean. The long hair, especially if women that are doing it, you just have to be extremely careful when you're washing.
I think I've asked you this before. This might be my final question for now, and then we'll touch base again in the future, but with washing your hair, does it matter the shampoo? I feel like you hear and you see so many commercials about all that kind of stuff. Does that matter? How much does that matter? Especially, right after a procedure like this, the type of shampoo you're using.
Well, we give people a little bottle of baby shampoo, and we want them to use that until it's gone. I mean, it's probably a couple ounces. It's not a big bottle.
Like an airplane travel size, kind of?
Exactly. And once that's gone, just use regular shampoo. As far as like growth enhancing shampoos, there's really no evidence. I have people that have tried all different shampoos. I haven't had a single patient say, "Oh, this is the best." Now, some of the thickening shampoos can thicken your hair, and thickening conditioners, especially some of the leave-in thickening conditioners, are great to cosmetically thicken the hair. But as far as like DHT blocking shampoos, growth supporting shampoos, there's just not a lot of evidence. I don't sell any products here. If people want to use them, great. But it's a probably a multi-billion-dollar industry with really minimal evidence support. The use.
Right. Makes sense. Hey, I've enjoyed this. As always, I'm always learning so much. Really appreciate the way you make it simple to describe. I know there's a lot that you do to make the magic happen, but you've been doing it a long time. You know how to communicate this. So
I appreciate
that being
it.
said, is there anything else that you want to share on this, or you feel good?
I think that's it. We're going to be coming out with some videos showing the long hair transplant process and get more people information to see if that fits what their needs are. And really the biggest need is the concealability aspect, and really long hair transplant is by far the highest level for concealment.
Fantastic. Dr. Danyo, as always, really enjoyed it. Looking forward to our next podcast session.
All right. Thank you, Clark.
Thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your free consultation today with Dr. Danyo by simply calling 678-845-7521 or visit them online at nahairrestoration.com. And be sure to subscribe, rate, and review the podcast wherever you listen to your favorite podcasts.